Back with you now on the Newsfeed Late Night. Reporting continues on Newsroom Africa, Channel 405. Newly qualified nurses who staged a sit-in at the Gauteng Department of Health demanding employment after their contracts were allegedly terminated without notice. They gave the department 5 days to resolve the matter after the department assured that all 983 community service nurses will be absorbed or permanently employed. It has been more than 5 days since their engagement with the department. To get an update on that matter, I'm joined now by the national chairperson of the Democratic Nurses Union of South Africa Student Movement, Nathaniel Mabelebele. Nathaniel, good evening and thank you very much for your time tonight on the Newsfeed Late Night. On the 28th of December, the president announced the level 3 lockdown because they were seeing a rise in a number of infections. In fact, we were seeing close to 20,000 infections a day in South Africa, which means naturally that our health facilities will be under strain, and not only that, our health professionals will also be under strain. Yet some of your members on the 31st actually of December say they received termination letters. How does that happen?
First of all, greetings to you and greetings to the viewers at home. It is quite surprising to actually pronounce that you have a shortage of nurses, and especially when we are facing a pandemic like this one, that actually needs all the hands together. And at the same time, you say that you cannot employ nurses, which is the situation that we are facing currently. And it's not an issue that is happening only in Gauteng. And if you go back to the issue of Gauteng, you would realize that it's not an issue that started today. It's an issue that has been happening even 4 years ago. And the sit-in as well today did not actually come in, just willy-nilly. It is as a result of the discussions that we've actually had the previous week about the absorption of these 983 community service nurses, of which a promise was made by the MEC and the chief nursing officer as well, who made that promise to say these nurses will be employed. We just needed a confirmation in writing so that nurses can go back to work, those who were terminated. And we did indicate when we were talking with media last week that should anything not happen within the 5 days that they were given, would actually come back and stage in another sit-in, of which this time we would intensify. Hence, we actually even slept at the Department of Health at 45 Commissioner to ensure that we get the answers to the questions and to the promises that we had made. But to answer the issue of why would such a thing happen, when we're facing a pandemic, I think it's a failure in leadership. And we must just be honest that the budget cuts that have actually happened, this is the reality that we are seeing. The pinch is felt in employment within the healthcare sector and many other sectors of employment. So we might not want to come out publicly and pronounce that there is a moratorium on employment, but the way the world of work behaves recently, it proves that actually there is a technical moratorium that exists, but it just doesn't, it's just not on paper.
Now, Nathaniel, some of the nurses, which is also quite confusing and surprising that we're talking about here, actually studied on government bursary. And they were also told that they will not be absorbed. So take us into those discussions, take us into those conversations. What are the reasons given around these 983 who've been, others have been given termination letters, others it was not even a termination letter, it was just a phone call.
Okay, so the issue here is that when you get into nursing school, you are given a contract that says we're going to fund you for 4 years, and for the 4 years that we have funded you, you are actually going to serve government that has actually funded you for the number of years they funded you. The first year of community service is compulsory, and the other years the additional 3 years as well. And part of that community service year, they are part of serving the government that has actually funded your education. And that strategy of community service, it came mainly because we wanted to keep nurses within the country because we had a shortage and nurses were actually graduating and leaving. But at the current moment, the strategy is not actually working because um, nurses are being trained only to be retrenched. I mean, we take it as a retrenchment the way it is. So you only train them for 4 years only to discard them. You are not creating the workforce to actually serve the government. You are actually creating the workforce to come and then you discard them the following year and prepare for other community service nurses comes. So the issue of contracts and all the other things, if I may confirm, when we were actually in that sit-in, we did find information from human resources to say the nurses that we were sitting with have, because they have provided information, it was confirmed that they were placed on permanent posts where they are where they are working. But now the issue of issuing a communication by word of mouth and say, don't come to work, you're no longer going to be employed. It's an error and it's an issue that is it's unprofessional. Hence, the decision that was thereof was that with the information that we received from human resources at central office, the nurses must report back to work tomorrow with that information, because if I'm employed on a permanent post and you are telling me by mouth that hey, don't come to work, then it becomes a
Yeah.
difficult issue, and
And
we can't
how
allow
how
to
many
be
nurses
retrenched
are
by
affected by that anomaly?
Um, so far, the nurses that we can't actually pronounce the number, but so far the nurses keep on coming to us one by one, and the number is actually increasing every day. So we were functioning with close to 200 nurses, but the ones that we have stayed the sit in with, because we are health professionals and we understand that we have a pandemic and social distancing and must be observed. We actually had to be with 20 nurses that were there with us at the sit-in. We slept there. So the numbers keep on increasing almost every day. In Gauteng, it's 983 nurses that are affected by this.
Yeah.
But that number of 983 is divided because others are supposed to be finishing that 1 year, the first year of community service at the end of January, and others are supposed to receive it at the end of
Yeah.
February. So both of them haven't, some of them which will be ending in February haven't received the news that they will actually be terminated
So,
by mouth, and
how many of the
so it's not formal.
983 have received a permanent appointment?
Okay. Um, I wouldn't give you the number, but I will mention the institutions that are there. So far, the all the 33 nurses at the Charlotte McGregor Academic Hospital have received this word of mouth termination, and in the Gauteng region of West Rand as well, there is all the nurses in that region have received such a communication. So that it means we just have to go and check how many are in West Rand who have received that information.
Yeah.
But as I've said, this information keeps on coming every day. So meaning if I give you a number today, tomorrow I might give you more numbers.
All right. Now, talk to me about the funding of these nurses. Is there a funding issue from your conversation that you've had with the Department of Health in the past week?
So there is funding. The meeting that was had with the MEC, a task team was put in place because there was a meeting had with the Treasury and also the Department of Health. A task team was set up because remember they made a commitment that they will actually absorb these nurses. The only thing that needs to be there is that Treasury must allocate, or rather find where this funding is going to come, and they're estimating 125 million that is actually going to fund this process. And they were actually trying to propose to us that the solidarity fund can actually be used to employ these nurses for at least 12 months until a permanent solution to the contracts that we are talking about, and the absorption that we're talking about is being dealt with. But so far, a task team has been put in place. We are waiting for the task team to actually just say this is the money, and the process can unfold. But however, the directive that we have, or rather the what we have today, is that a circular will be issued just like the previous week. And we ensured that when we leave there, the circular is written, because we actually even saw it ourselves as it was written. And the only thing that is happening now is to chasing the signatory, the person who's supposed to sign. And that's circular should be out by tomorrow morning in all the facilities, saying nurses must come back to work. Then the issues of funding, of whether Treasury will find money elsewhere, it's a commitment that they've made, hence they set up the task team. So that will unfold while businesses are back at work.
Yeah. Very briefly, about 30 seconds, Nathaniel, talk to me about the department saying, well, they're not sure whether they will be absorbed or they will be made permanent. What is the difference, and what's the discrepancy? What's the disconnect?
Okay. So the department is not saying they are uncertain that they will absorb these people. They are saying that they will. The only issue that is pending now is to allocate funds for this process to unfold. So there's no confusion between whether they will be absorbed or not absorbed. Because when we mean absorbed, we mean that you put us on permanent employment, right, and serve as part of the system. Now, the only confusion that I think might be there is these 12 months contracts that are being offered. Because even when they offered those 12 months contract, we said before any signing of any contract, there must be also an attachment that will be an agreement to say, after this 12 months of 12 months contract, because we can't sit at home and wait for you to look for funds.
Nathaniel,
We will also have
that's where we're going to have to
that.
leave it, unfortunately, because of time. I do appreciate it. The NASA Student Movement Chairperson there, Nathaniel Mabelebele.